Thanks for listening to me, Kim. I was just wondering whether I could ask you in reverse a few questions so I can get some understanding for families from a parent's point of view.
Yep.
Would that be all right?
That's fine, yeah.
Great. How was your journey getting a diagnosis with your daughter?
She was really little, and there were lots of health issues. She had lots of very low blood sugars. These were unexplained, and she was in hospital a lot, which was quite hard.
Yeah.
She had no speech, and still doesn't talk. She was late with all her milestones to sit, crawl and walk. We now know that this was due to a muscle wasting condition called myotonic dystrophy.
And that's quite recent diagnosis?
Yes, it was. It comes from a parent, and I was diagnosed as an adult, so these problems that she had, we didn't know that she had them because I was diagnosed late, and thus so was she. I was quite young when I had Charlotte, only 21, and I didn't know what I was doing with a baby, much less a neurodiverse one. It was quite hard. I was put on lots of courses for parenting, and someone said to me, if you want your child to learn to talk, you have to talk to them.
And of course you were doing that
all the time, you know, about everything, as you do with any baby. And it wasn't helpful, to say the least. We went through the Ministry of Education's early intervention office, and we had an early intervention teacher and a psychologist, and we did play observations through a big one-way mirror with someone playing with her, and then me entering the room and see if she was different, how she played with toys, which is different to typical developing children. I think that's called an ADOS.
It is.
And then we did something called the CARS test. And my husband did it, I did it, psychologist did it, and I think kinder teachers may have as well.
And then they put all the results together.
And they correlated well, so she wasn't reacting differently for different people, so it was quite clear that she was on the autistic spectrum. And this was right about the time she was 3.
Okay.
Yep.
And so that's a good age, because I get many referrals for children from as young as 2. Generally not much younger than 2. And it means that it's really good because you can get early intervention, you can get a lot of help before they go to school. For some children, when it's not quite so clear, they might be a wee bit older, more like 6 or 7. For some who mask a lot and don't show the autism, and masking is obviously trying to fit in, then sometimes it's as late as 12 or 15, which is really hard.
That would be really hard.
Yeah, it is. So that's awesome.
Yeah.
So how was your journey for your son? Was it much different?
Yes, it was very different. Obviously, Charlotte's paediatrician knew my son from our visits for her, because he used to come along. So we had a clinic appointment for him, just sort of some observations and questions and things. And then you actually came on a school visit first,
and
I did. Came to see us at home to give us your observations and how you found that. Then we had another clinic appointment with his paediatrician. At that appointment, they had enough information to say that autism was probably quite clear, and they said that we didn't need an ADOS.
Oh, brilliant.
So we didn't have to go through that with him, because, you know, his older sister.
Sure.
So we got a diagnosis on that second visit, because it was very clear that he was on the spectrum.
So when it came up that someone sort of said that there might be some differences for him, how did you feel?
I wasn't shocked, because I'd already gone through things with Charlotte. But I was more worried about his speech.
Right.
He started kindy, and he was saying single words, which by 3 most kids are saying, you know, talking quite fluently. Within 4 months he was speaking fluently though. So we kind of think maybe it was a little bit of learnt behaviour, because he saw his sister getting things without having to use speech and gestures, and she would bring us things. And maybe he learnt from that, so he didn't feel the need to use his words. But he caught up quickly.
Fair enough.
Yeah.
And how old was he when he got his diagnosis?
Nearly 7.
Cool. So that's more the age that we often see.
Yeah. I mean, we saw signs a lot earlier, but we sort of held off as well because it's hard having 2.
Yeah.
But
totally.
it was, there's family history on both sides, and we had Charlotte, so we knew what we were dealing with.
Yeah, sure.